Hello and welcome once again to our sample questions, Viva questions from October 2022. Like I always say, almost every year they keep repeating, or every exam, they keep repeating the previous ones. So today we'll be dealing with the pediatric aspects of the Viva section. If you are new here, do well to like, subscribe, and share. And of course, if you want more of these and the answers to all these questions, you can find it on medentweb.com. A link will be put in the description, so you can just quickly go in there and click on it. It will take you straight to the website. And again, I have a Telegram page. Again, I'll put the link inside the description, so do well to follow or join. So let's begin. All right, so one of the questions that were asked is neonatal jaundice. Neonatal jaundice. And they're saying that the child is breastfeeding well and both mother and child are B positive. So I always tell people when it comes to jaundice, you should know almost everything about it. So the question was differential diagnosis. Differential diagnosis. Even though breastfeeding is good, mother and child are B positive. So what are your differential diagnoses for neonatal jaundice? What could be the possible causes? And for them to ask you what's the difference between breast milk jaundice and breastfeeding jaundice, at least this is even what a differential. But what other thing can cause neonatal jaundice? So please, if you want the answers to all of these, I will put them in the website. So please do well to subscribe to it, medentweb.com. What are some of the investigations you would like to do to help you diagnose this patient? So a 1-year-old, 5 kg, cold hands and feet, lethargic, capillary refill is 5 seconds. It's more than 5 seconds. Again, what could you be thinking about? What could you be thinking about? Indication for prolonged capillary refill. Prolonged capillary refill. If you've been following my tutorials on pediatrics, you will know that this question is all about dehydration. Dehydration. So you need to know a lot of things about it. All right. Then 2 bedside investigation, not examination. Bedside investigation that you could do for this patient. Then the first 3 initial management. How will you rehydrate this child? Again, I will put all the answers. But of course, we can interact over here. So in the comment section, please do well to let us know what you think about these questions. All right. Then there was a case of a newborn with RBS of 1.5. Very, very important. So this is like a hypoglycemia, right? Hypoglycemia. So what could be the reason? So what are your diagnoses and what will be your direct questions to help you narrow your answer? So definitely hypoglycemia. So what are the possible causes of hypoglycemia in a newborn, right? So you ask relevant questions. The childbirth, the weight of the child, all important things that you have to look out for. All right. Then how will you treat this patient? How will you treat this patient? Sometimes it's very, very funny that even when you give dextrose, the sugar will rise. After some time, it goes back. I've had a case like that before, whereby when I'm giving the dextrose per the protocol, it will come, then it will go back. So it's like NICU was a very, very stressful, how do you call it, rotation, but we have to go through it. And I believe you'll be fine. So how will you treat this patient? Very important. A 7-year-old child with generalized swelling. Generalized swelling. So when it comes to Anasaka, every question about it, you should be able to know. So what are your differential diagnoses? What are your differential diagnoses? I always tell people anytime it comes to edema, so because swelling is more or less like edema, right? There are always some organs you always have to put it at the back of your mind. The cardiovascular or the heart, the liver, the kidney, the GIT. These places are where you should find your diagnosis. So you ask relevant questions pertaining to these organs, and it will help you narrow your answer. What investigations are you going to do? Again, depending on your different diagnosis, you can know which type of investigation to do. And I always tell people, don't let your investigation be totally different from your differential diagnosis, because it is based on your diagnosis that you are investigating to confirm, to rule in or to rule out your differentials. So please, it must always tally. There's a case of a 4-year-old who came with chest x-ray and has fever and cough. Fever and cough. So I believe they were given a chest x-ray to read. So they asked you to describe the x-ray. I've done a whole video on how to describe an x-ray. Demographics are very, very important. You need to tell the age of the child, the date in which the x-ray was taken, the time it was taken, right? All of these things are all important, even before you start reading. And in reading, there is an approach which I have highlighted in the x-ray reading. It is one of the videos that I've done on YouTube, so you can check it up, and then you come back to this question and see how best you can answer it. But for those who are on Medent web, definitely I will do it for you guys. All right. Okay. Then general physical examination. General physical examination. Again, is based on this child, the x-ray, right? So you have to know what to look out for on physical examination, especially when it comes to the lungs, examination of the lungs, your percussion, dose resonance, the breathing pattern, the air entry. All of these are all important factors you have to look out for when you are doing your physical examination. For those who want a video on physical examination, let me know and I'll put it up for you on this channel. So a case of asthma. Again, asthma is one of the most common topics they always ask us during an exam. So please make sure you have mastered asthma. Then questions to ask in the history. Questions to ask in the history. Very, 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 very important when it comes to asthma. Then what will you see on examination and the management? So what will you see on examination and how are you going to manage an asthmatic patient? How are you going to manage an asthmatic patient? Then, this is very important. If after everything the patient is still worse, what will you do? So you're in the ER, they come to you, difficulty in breathing, wheezing, and all of those things. You are giving your salbutamol, even oxygen, but still patient is still not responding. What do you move to? What do you move to? Sometimes you have to even add ipratropium, right, to the salbutamol, even with oxygen. All of these are things you have to look out for. All right. We shall talk about this more later on. But again, if you have any idea, please put it in the comment section so that we can all learn from you as well. The difference between abduction and fostering. Abduction and fostering. So what does it mean? What does it mean? Then what is child abuse? Child abuse, we get it a lot in these few days. We've been getting it a lot. So it's very important you know what child abuse is, and even the types of child abuse. The types of child abuse. So these are very, very, very important things you have to know. And these are the questions that they got just in October 2022. So if you're preparing for February or any other exams, please make sure you have mastered these questions, because I'm not a prophet, but you'll still find some of these questions there. All right. And that brings us to the end of this section. I'll be doing another video for the other disciplines. Again, I have Telegram page so I'll put the link in the description. If you want more of these, check medenweb.com. I'll put all of those in the description. So please, let's get interactive.